So today we're going to be inserting an NG tube in our patient. We'll start off by discussing the materials that we're going to need. The first thing we're going to need is our NG tube. We'll need a glass of water. If our patient's NPO, we might not need this, but we'll get to that later. We have a marker, a piston syringe, water-soluble lubricant, a tongue depressor, as well as a pen light, tape for securement. We'll need our Chuck's pad. We'll need our stethoscope. We will also need an SpO2 probe. So the first thing we're going to do when we're inserting NG is to check the patient's orders. Check the doctor's orders, make sure we know why the patient's getting an NG tube and for what reason. The second thing we're going to do is enter the patient's room, perform hand hygiene, and introduce ourselves to the patient. Hello, I'm going to be inserting an NG tube into you today. Could you give me your name and your date of birth? The patient identifies themselves and I ask them if they have any allergies. The next thing I want to do is discuss with them any history of facial trauma, any nasal trauma that they've had in the past. I'm going to set them up in a semi-Fowler's position. If they've had nasal trauma or facial surgeries in the past, we would need to speak with the provider to make sure that this was a safe procedure for our patient. The next thing we're going to want to do is have the patient blow air out of each nostril to decide what nostril we're going to use. And then after we do that, we can explain the procedure to the patient. So, Mr. Smith, I'm going to insert an NG into your nose today. That's going to go down your nose, down the back of your throat, and into your stomach. The patient's agreeable to have the procedure done, and then I'm going to assess my patient. The first thing to assess my patient, I'm going to put a pulse oximeter onto his finger. This is going to help me during the insertion of the NG tube to make sure that I'm not putting the tube into the lung, so I need to make sure that I'm watching his pulse ox through the entire procedure. Turn the pulse ox on and watch his oxygen. I'm going to perform an abdominal assessment on my patient. So the first thing I'm going to do is auscultate in the right lower quadrant, starting with the right lower. And then I'm going to palpate the abdomen, right lower quadrant, moving around clockwise, checking for any distension or rigidity in the patient's abdomen. So I can cover him back up. The next thing I'm going to want to do is cover my patient with a Chuck's pad. Just in case he does vomit during the procedure, we can kind of keep him clean there. If the patient is not NPO and he's able to drink, you can ask a unlicensed personnel or another nurse to come in and help you with the procedure just a little bit easier so they can swallow the water during the procedure. And we'll put his cup over there. The next thing I'm going to want to do is cut my tape. So we'll cut a piece of tape and then we'll put this off to the side for later for when we secure our NG. We'll take our tape, go down the middle here, and have like a little set of pants there, and we'll put that on our table. The next thing we need to do is measure our NG tube. So our NG we're going to measure from the tip of the nose to the earlobe, all the way down to the xiphoid process. Some NG tubes have markings on them, so you could take your marker and put a little line where the NG will go into, or you could put a piece of tape so you're aware of where the NG will be placed. The next thing I want to do is put lubricant all over my NG tube, just so it's a little bit easier for it to pass down the nose. And after I have that, I'm going to need to put on some gloves. All right, I have my lubricated NG tube. And to make the procedure a little bit easier, I like to remove the pillow so the patient has free range of motion of their neck. So I'll put that at the end of the bed. And we decided that we're going to do the right nostril. So we'll go in, have the patient have his head back, and then we start to meet resistance. We're going to have the patient tilt his head forward. And at this time, the patient could be swallowing and drinking the water. If they're NPO, they can just simply swallow. They don't need to be drinking water. And we're going to insert all the way to our line that we have with the indelible ink. So after we have that, we're looking in the patient's mouth with the tongue depressor, making sure that it's not coiling anything behind the throat. We're watching the patient's pulse ox, and then you can also use your pen light just to get a better glimpse back there to make sure that the NG tube is not coiling in the patient's neck. After we have the NG tube in, we'll have the patient talk, making sure that he can speak with no issues, that the tube is not coiling in the back, and his pulse ox is okay. We're making sure that the NG is all the way up to the nostril in where the indelible ink is. And then we're going to secure the patient's NG tube, wrapping one side around the NG and then the other around the NG. And then to confirm placement, we're going to send the patient down for an x-ray.